Hello, learners. Welcome to this session in which we shall be talking about behavior with persons with disabilities and all genders. Now, dear learners, in the hospital, you must be meeting all types of patients, diverse patients, including those with disabilities, third gender patients, transgenders, and other groups. As we all know, India is a land of diversities, and there are many, many diverse kinds of people who come to the hospital for healthcare. We are familiar with most of them, but patients with disabilities or those with different gender orientations or different genders are usually regarded with a great deal of prejudice. So, there is a lot of prejudice and discrimination that exists against these groups in society in general. And very often, not much is known about them and what kind of treatment they require. We see that even in the healthcare settings, this discrimination may be seen because, after all, healthcare professionals are also a part of the same society within which this kind of prejudice, lack of understanding, and discrimination exists. However, as healthcare professionals, it is your duty to behave and communicate with these diverse groups in a respectful and appropriate manner. And this is what we are going to be discussing in this lecture. So, firstly, let's begin by talking a little bit about diversity and inclusion. So, including and addressing the unique needs of various genders and persons with disabilities through accessible, culturally competent, and non-discriminatory services is very, very important. So, what do we mean by these terms? We shall be discussing these further in the lecture. We also need to talk about systemic changes. What are the changes that need to be made in the system so that persons with disabilities and persons of different genders are represented properly? So, workforce representation and policy implementation becomes very crucial in this regard. Very important is that we need to overcome barriers such as prejudiced attitudes, inaccessible infrastructure, and a lack of tailored health services for persons with disabilities and diverse gender groups. When we talk about barriers, we can speak about physical barriers as well as attitudinal barriers. And while physical barriers are fairly easy to overcome and to change, attitudinal barriers require a lot of work, a lot of awareness, because changing well entrenched attitudes or changing stereotypes requires a lot of time and a lot of self reflection also. Also, we must ensure, particularly as healthcare professionals, that everyone feels respected, valued, and supported. Why are diversity and inclusion important? Now, this is a very, very important question. Firstly, these are related with health equity. As you know, health equity means that everybody in society, irrespective of their age, caste, class, gender, ability, or disability, etc., are all entitled to high quality healthcare. Being aware of diversity and inclusion is also important because it helps healthcare providers provide a better quality of care. When we understand the needs of diverse populations, we are able to create strategies or put in place systems which will enable them to receive a better quality of healthcare. It is also important to talk about rights. So, every human being has certain basic human rights, and persons with different kinds of gender orientations or gender identification, or persons with disabilities, also have the same rights as any other citizen to receive a high quality of healthcare. And addressing inequalities is also a very, very important aspect because the goals of social justice, the goals of equity, inclusion are very important goals in a democratic society. And therefore, being aware of diversity and inclusion and valuing diversity and inclusion helps us to address these inequalities and inequities in a better manner. Let's talk now about the specific challenges that are experienced by persons with disabilities, particularly with regard to the health system. Now, firstly, it is important to understand that disability is a very, very diverse category. So, for instance, under the category of disability, we have persons with physical disabilities, persons with psychosocial disabilities, persons with developmental and intellectual disabilities. Disabilities may be temporary, disabilities may be permanent, they may be congenital, they may be acquired during the life course. So, disability as such is a very, very diverse category. And as healthcare providers, we need to be aware of these categories and how to deal appropriately with persons with different kinds of disabilities. So, let's talk first about accessibility barriers. We find, particularly in hospital settings, that accessibility is a big issue. Infrastructure, transportation, the public spaces within a hospital, toilets very often tend to be inaccessible for persons with disabilities. And this is a major, major issue. Provider attitudes, for instance, as we've mentioned earlier, prejudiced attitudes and a lack of awareness amongst healthcare providers about the rights and the needs of persons with disabilities can also be a major challenge and a major barrier. And also, the need for tailored services, specific healthcare services, rehabilitation services, assistive devices, and so on, which each disability group may need and which may differ from group to group. So, for instance, within the healthcare setting, a person with visual impairment may need certain kinds of assistive devices to be able to negotiate the system, whereas a person with hearing impairment may require the assistance of sign language interpretation and so on. So, each category of disability has its specific needs, has its specific requirements, and services need to be tailored in accordance with the needs and requirements of those individuals. What about diverse genders? Now, gender for a very, very long time was thought to be a binary category. That is, you either have men or you have women. The concept of third gender, however, has been very much present in all human societies, including in ours. These days, we also use the category LGBTQIA, which covers the entire gender spectrum, including lesbians, gays, bisexual, transgenders, intersexed individuals, and so on. So, the discussion around gender has become much more complicated in contemporary times, and we no longer speak about gender strictly in terms of male and female. Now, persons who have different gender identities persons with different gender identities have often found it very difficult to be able to survive in society without being discriminated against or without being stigmatized. So we see that the concept of gender bias is something that is present across societies. And you often see very discriminatory practices and entrenched gender norms which indicate what are the appropriate ways of being male and female and which really don't make space for other genders. So people who don't identify as male or female, or a male who identifies as a female who identifies as male, is very often seen as being in some sense abnormal or going against the norms of society, and therefore very, very stigmatizing attitudes and values pervade, which make life for these individuals very, very difficult. We also see that this section has a lot of unmet needs. For instance, they may have a lot of medical issues which they cannot really address or which they really cannot speak about openly because their gender identity itself is surrounded with so much negativity. Another very important concept that we need to talk about is intersectionality. So, intersectionality basically means that all identities are connected with other identities. So, for instance, if I'm a woman, I'm not just a woman, I'm also a woman who comes from a particular caste, a particular class, a particular religion, and so on. So, all these identities of mine intersect. So, when we speak about any identity, we have to look at the intersecting identities. So, you will definitely appreciate and understand how a woman who may be disabled, who may be poor, who may come from a discriminated caste will face far more challenges than a woman who may come from a higher class or a more respected caste, and so on. And gender and disability are these two intersections about which we are talking about in this particular lecture. The term diversity and inclusion is a term that has been used globally to refer to the way in which diverse sections of society are included in all aspects of society and in all institutions. And diversity and inclusion, or as we call it, DEI, in healthcare is also very, very important. Why is this so important? So, firstly, this results in workforce diversity. So, if you have persons with diverse categories like caste, race, ethnicity, gender, sexual orientation, socioeconomic status, and disability, this kind of workforce diversity is something which is a very important aspect of a democratic society. This also results in culturally sensitive care. So, culturally sensitive care means that we must be sensitive to the needs of different persons and be sensitive to their cultural practices and be able to give them the kind of healthcare that they need, keeping in mind their cultural practices and their cultural sensitivities. Equitable access to care ensures that all patients, regardless of their background, have equal access to quality health services. And diversity and inclusion are crucial in ensuring equitable access to care. Inclusive environments. So, as healthcare workers, it is very important for us to create a welcoming and inclusive environment for both patients and staff. So, they must not be made to feel that because they come from a particular category or because they may be different in some sense from others, they are not welcome, they are considered as being abnormal or people who don't have a place within the healthcare setting. So, making a space where every type of individual is respected and welcomed is very, very crucial in ensuring diversity and inclusion in healthcare. And this also results in patient engagement and empowerment. So, if patients of all types feel welcome, feel that they are given respect, feel that they are accommodated, they too will engage with the healthcare providers and will feel empowered to obtain the best quality of care for themselves. So, as healthcare providers, patient engagement and empowerment is a kind of an indicator of the success of our practices. Let's continue by discussing the benefits of diversity and inclusion in healthcare. So, this results in improved patient outcomes. Naturally, a patient who feels welcome, a patient who feels respected, a patient who feels that his or her needs are adequately addressed and taken care of is naturally going to fare better than a patient who feels frightened, a patient who feels that he or she is not really being treated with the kind of understanding and the kind of respect that he or she deserves. Enhanced communication and trust. When there is diversity and inclusion, there will be better communication, there will be an atmosphere of trust in which patients experience a sense of comfort and a sense of trust in the healthcare providers, and healthcare providers too feel a sense of satisfaction that they are able to help the patient in the best possible manner. And DEI also results in increased staff satisfaction and retention. So, when employees feel valued and included, they are more likely to be satisfied by the job and remain with the organization. Now, let's discuss more about the importance of diversity and inclusion skills for nurse managers. We've discussed the importance of DEI, Now, what are the specific skills that you need to cultivate or you need to train yourself in so that diversity and inclusion can be fostered in your workplace? So, firstly, very simple, providing patient friendly and welcoming environment, making every category of patient feel welcome. Cultural competency, communication, conflict resolution, good behavior and conduct are all essential skills. These are basically people skills that you require in order to foster an inclusive environment. Appropriate conduct with all genders and persons with disabilities is also very important for a good nurse manager. And for this, you need to use respectful language, practice active listening, and ensure clear and inclusive communication with your patients and with your colleagues. What do we mean by gender sensitive and disability sensitive approaches? So, when we talk about gender sensitivity, we have to be mindful of gender pronouns and avoid making assumptions about individuals' gender identities. So, for instance, we see that these days, certain categories of patients want to be referred to as she or he or they. Sometimes they use gender neutral pronouns also. And this is something that we need to be mindful about. We need to be aware of this and need to address our patients in whatever way they find most comfortable. Disability awareness is also very, very important. So, for this, we need to use very clear language. How does the person with disability want to be addressed? How do they want to be spoken to? What are the various assistive devices that they require? Do they need any alternative communication methods? So, we've mentioned sign language interpretation. A person with visual impairment may require braille or may require certain softwares that enable them to understand what is being communicated. Persons with intellectual disabilities may often benefit with the use of apps. Certain communication apps these days have become very, very common. So, as nurse managers, we need to know what it is that our disabled patients may actually require, what will help them to communicate best with us. Professionalism is the key. So, when you are in a professional setting, you have to maintain professional etiquette in your interactions, the tone of your voice, your body language, and your choice of words. So, you need to avoid any form of discrimination or bias in your interaction with your patients. Active listening is one of the very, very important skills that all individuals who are in professions that require interaction with different segments of people need to cultivate. So, we really need to not just hear what the person is saying, but actually listen and understand what is being said and sometimes what is also not being said. So, an individual may say something but may not say certain things, but we have to cultivate the sensitivity to understand what is not being said also. So, active listening is a very, very important skill for nurse managers. Let's talk a little bit more in detail about how to cultivate a gender sensitive and disability sensitive approach. So, clear communication is crucial. Talk simply, use local language, and avoid jargons. So, when you're explaining something, try to avoid the use of technical terms wherever possible. If you find that the person is not able to understand what you are saying, try to speak in their language and try to simplify what it is that you are trying to convey so that the message goes through. Inclusivity is very important. So, you need to create an inclusive environment where everyone feels respected and valued. We have mentioned this point several times, and it is very, very important to bear this in mind. Confidentiality is very much a part of your professional ethics. You need to maintain patient confidentiality and privacy in all communications, regardless of gender or disability. And training, you have to ensure that all staff are trained in best practices for communicating with diverse populations, including individuals with disabilities and different gender identities. Cultural competence is a very, very important quality, a very, very important skill. And by this, we mean that we need to understand and respect diverse cultural backgrounds, beliefs, and practices, and adapt our care accordingly. So, you are well aware that in India, people come from various kinds of cultural backgrounds. They may have certain beliefs, they may have certain very, very strong values which they don't want to surrender. And you should be very, very careful to ensure that these values, these beliefs of them, are respected within the clinical setting also. Once again, effective communication, including active listening and empathy. Conflict resolution, or addressing conflicts that may arise from cultural differences or misunderstandings in a fair and respectful manner. Adaptability, that is, being flexible and willing to adjust for the specific needs of diverse individuals. So, when a patient comes to you, it is you who need to adapt to the needs of the patient rather than the patient adapt to what you want them to do. And self reflection. This is a very, very important thing that must be regularly practiced. So, you need to reflect on your own biases and assumptions about different categories of patients. None of us is perfect. All of us have our biases, all of us have our prejudices. But being in this profession, it becomes even more important for you to think through your own belief systems, to think about your own prejudices, and then try and make yourself aware about the changes, make yourself aware about what kinds of people are coming to you and what their specific needs and what their specific requirements are. Let's talk a little bit how we can support persons with disabilities better. So, one of the important things that we speak about when we talk about disability and when we talk about disability rights is that the person must be placed before the impairment. So, the individual is always a person who has an impairment. So, look at the whole person, don't just look at the impairment. A person may be visually impaired, but that person is a whole person. The visual impairment does not completely define the individual. When you want to help somebody with a disability, you may feel the urge to help, you may feel the urge to assist, but always ask the individual. An individual may not want your help. You may feel that they need your assistance, but they may be perfectly capable of doing their own activities and may not really need you to help them. In fact, they may feel a little bit offended if you try to force your help upon them. You must also be very sensitive about physical contact. There is a belief in many parts of society that persons with disabilities are helpless, they cannot do anything on their own, and therefore we have to help them, we have to physically intervene in helping them to do their activities. And this can be quite damaging to their self-esteem because many of them are perfectly capable, like I've mentioned, about doing their own activities, and it may be quite intrusive if somebody keeps touching them, if somebody keeps trying to make them to do things that they may not want to do. Also, think before you speak. Sometimes, inadvertently, we may say things or we may utter certain words or phrases that can be very hurtful to the other person or may be offensive to the other person. So, therefore, we need to very carefully reflect on our words, on our language before we actually utter them. And one very, very important thing, speak directly to the person with disability. It is so often seen that when there is a person with disability in the room and he or she is with an assistant or a partner or a friend, people will speak to the non-disabled person asking about what the disabled person wants. Whereas the person with disability is perfectly capable of speaking for themselves and answering for themselves. However, if it is not possible for you to communicate directly with the individual, speak to their companion, their aide, or their sign language interpreter. But as far as possible, ensure that you are speaking directly to the individual with disability if they are able to understand you well. Respecting their privacy is also very, very crucial. We must not behave in ways that is violative of their privacy because we think that they are incapable of having a concept of privacy, which is completely inaccurate. And don't make assumptions about what they are able or not able to do. How do we support other genders? So these days we hear a lot of this term LGBTQIA+, which basically refers to lesbians, gay, bisexual, transsexual, queer, intersexed, and others. So firstly, accept them for who they are. Recognize your bias. We tend to have a lot of biases, we tend to have a lot of prejudices to anybody who is different from us. Don't ask intrusive questions. Challenge discrimination, misconceptions, and stigma. You play a very important role in the healthcare setting, and you can actually be a change maker. Like we've mentioned for persons with disabilities, don't make assumptions. Listen to their experiences. Show them you care and support them to seek help. Very often, persons across the gender spectrum may have, like we have mentioned earlier, unmet health needs. But if you support them adequately, they can actually seek help for their health issues. Now we come to a very important aspect that you as a nurse manager may have to deal with, which is sexual harassment at the workplace. Sexual harassment is any unwanted sexual behavior that makes someone feel upset, scared, offended, or humiliated. And it is a type of sexual violence. In other words, it is something that happens without consent. Workplace sexual harassment creates an insecure and hostile work environment for women. It affects their ability to work and cope up in life and affects their mental health as they go through physical and emotional suffering if they are facing sexual harassment at the workplace. Now, we have a very important law which is known as the POSH Act, POSH Act. This is the Sexual Harassment of Women at Workplace Prevention, Prohibition and Redressal Act of 2013. And this was enacted by the Ministry of Women and Child Development in 2013. Rules were notified under the POSH Act titled The Sexual Harassment of Women at Workplace Prevention, Prohibition and Redressal Rules. So every establishment is covered or has to go by the POSH rules. What is the need for this act? Firstly, we see that the workforce, the female workforce, is increasing. Particularly in healthcare settings, particularly, for instance, in professions like nursing, we find that a large number of women are employed. The act was also necessary to uphold women's constitutional and human rights, including the right to work in a safe and dignified environment. And this legislation provides a framework for preventing sexual harassment and a structured procedure for addressing complaints of sexual harassment. The goal is basically to create safe and productive workplaces and also legal compliance with the law of the land. What is the role of the nurse manager here? So firstly, providing a safe environment for women employees, ensuring compliance and making sure that the department adheres to the Act's requirements, such as displaying POSH policies and ensuring the hospital's ICC, that's the Internal Complaints Committee, is functioning. So as a nurse manager, conducting of training, supporting reporting, preventing retaliation, and being an exemplary role model are also part and parcel of your duties as a nurse manager. In conclusion, we can say that the nurse manager plays a crucial role in creating a safe, inclusive, and accommodating atmosphere in the healthcare setting for both patients and staff. Persons with disabilities and LGBTQI+ individuals are amongst the most stigmatized and discriminated, and often have unmet health needs. Nurse managers must acquire the cultural competence and diversity and inclusion skills to treat diverse patients with respect and provide high standards of care. With regard to staff, diversity adds value to the quality of care. And nurse managers must also ensure that sexual harassment is identified and addressed effectively and provide a safe and secure working environment. Thank you.